among healthcare workers, residents of congregate care settings, and within certain types of workplaces that pose a higher risk of large numbers of people working in close proximity, such as the food processing plants where we've seen a number of outbreaks. I mentioned this, Director Erzman's going to talk a little bit more about this in her comments shortly. We have a new total of 1,344 deaths in Minnesota, up 19 from yesterday. This represents 6 people from Ramsey County, 5 from Hennepin, 3 at Anoka, and 1 each in Dakota, Nicollet, Olmsted, Rice, and Sherburne. The total includes 1 person above the age of 100, 3 persons in their 90s, 4 in their 80s, 5 in their 70s, 4 in their 60s, 1 in their 50s, and 1 person in their 30s with no underlying conditions reported at this time. 13 of these people were residents of long-term care facilities of various types. There are 345 patients currently hospitalized, which is a net decrease of 4 over the prior day, and 10 fewer in intensive care. So as mentioned, we had a good lab volume again yesterday, and so we, again, I think are back on our pattern after the data cleanup of, we do expect to see day-to-day variation, but strong capacity remains for testing. I'd like to comment briefly on the new long-term care visitation guidance that we have been posting. We understand the impacts of the COVID-19 pandemic on long-term care residents and their families. And we continue to be very mindful of how the effects of isolation can have very serious impacts on the health and well-being of residents. And we know that visitor restrictions, while intended to protect residents from infection, have been extremely challenging for residents and families, including so many of us, over these last several months. We've been actively working on developing guidance over the last several weeks that can give residents, families, and other friends and loved ones that connection once again. The guidance for window visits that we released earlier this week was one step in that process. Again, I have to just emphasize that we know that the COVID-19 pandemic is very serious and very threatening to long-term care residents, and that many safety restrictions are going to need to remain in place for quite some time. But we also understand the need to balance health in the larger sense and psychosocial well-being with these restrictions. So yesterday we added some additional outdoor visitation guidance to our website. And outdoor visits can help give us that connection in this time, especially when these visits are done in a safer way. This guidance is effective immediately, and we strongly encourage facilities to follow the guidance and assist in implementing it. We do continue to work on the broader issues around guidelines for safe visitation as the pandemic continues to unfold. I would like to comment a little bit on community testing. Over 7,000 tests were done at community testing sites in Minneapolis and St. Paul between last week and this week, and results are still coming in from those tests. And due to a significant increase in cases of COVID-19 in Mower County, our health department, in partnership with the county, is holding a mass testing event this weekend for anyone who lives in that area to be tested. The testing will take place at the Mower County Fairgrounds on Saturday and Sunday from 11 in the morning to 6 p.m. in the evening. Anyone who wants to be tested is encouraged to come, even if they don't have symptoms of COVID-19. The expansion of this testing initiative just couldn't have happened without the commitment and partnership of state and local healthcare and public health teams in this region, and I want to thank them for working to make this event a success. I think you will continue to see an emphasis on community-based testing in response to where we know there might be under-testing going on in certain communities and in response to increases in cases in more targeted areas. So I think with that, I am going to turn it over to Chris Erzman for some further comments.
Thank you, Commissioner. I want to update you on some new data that's been included in our weekly web report. As we collect and share data about the ongoing impacts of the COVID-19 pandemic in Minnesota, we continue to look for ways to improve the usefulness of the data that we share. As we've talked about before, we have a weekly report that is updated every Thursday with some additional detailed data. We've added a few things to that report today. Those are testing data by county, information on languages most often used during case interviews, and we're now sharing our race and ethnicity rates as age-adjusted rates instead of cumulative rates. For this last change, I'll explain a bit why age-adjusted rates is a particularly helpful way of looking at this data. A cumulative case rate, which is what we used to show on the website, is the number of COVID-19 cases by race or ethnicity per 100,000 people in Minnesota. This allows us to compare rates for racial and ethnic groups that have very different population numbers. However, there are significant differences in the age distributions across some of these racial and ethnic groups. Some groups trend younger and some trend older. Given the differences in how COVID-19 impacts people in different age groups, it's important to consider differences in age distributions across these groups when we're assessing COVID-19's impact. So that's why this adjustment was needed. It helps us better understand what is happening in Minnesota, and we know that other states are looking at their data in this way as well. Age-adjusted rates are shown in the report for race and ethnicity data by cases, hospitalizations, ICU admittance, and deaths. We've talked about the disparities that we've been seeing with COVID-19, and these age-adjusted rates actually further highlight those disparities. For example, with these age-adjusted rates, we see that hospitalization rates for Asians and Hispanics are much higher than other groups compared to what we previously saw with cumulative rates. And we also see that deaths among Blacks are much higher. We're working to ensure that we have equitable approaches to prevention, information dissemination, data collection, and testing using a health equity lens. And we will continue to look at our data and work with communities to address these disparities. And I'd like to talk a bit to our younger Minnesotans about COVID-19. Today's news of another death in a person in their 30s who did not have any underlying health conditions is a stark reminder that COVID-19 is not only a disease of old age. We know that the greater risk of severe illness and death is associated with advanced age and underlying health conditions, but this disease continues to surprise us in unfortunate ways. Over the last weeks, we've been getting emails and social media messages from various members of the public expressing concern about what they describe as large gatherings of teens and young adults, seemingly without consistent social distancing, masking, or other precautions. I absolutely understand the desire to be with friends and have fun, and we want you to be able to do that. But even if you are young and healthy, we need you to do your part to slow down the spread of COVID-19. I really think that our teens and young adults are the generation that is going to make a real impact on our world, addressing environmental issues, racial justice issues, and I'd like to ask that you also consider the important role that you can play in making a difference in COVID-19 in Minnesota. We need that same level of engagement and dedication from you. Please practice social distancing. Wear masks when you're in public. Wash your hands, cover your cough, and certainly get tested if you feel ill or feel that you've been exposed to an ill person. And definitely stay home if you're sick, no matter how appealing the party or social event will be. And parents, please talk with your teens about the need to take this risk seriously. Even if you're among the lucky individuals who don't develop serious illness, you can unknowingly pass it along to others who may get very sick. So I ask for the same level of change, being the same active change agents that you are for so many important issues that we face, that you can be a change agent related to COVID-19 as well. And with that, I'll turn it over to Deputy Commissioner Heather Mueller from the Department of Education.
Thank you. Good afternoon, everyone. I'm Heather Mueller, and I'm the Deputy Commissioner with the Minnesota Department of Education. This week, Minnesota schools wrapped up a school year like we've never seen before that brought uncertainty and unforeseen challenges for our students, their families, our educators, and our school communities. And on behalf of MDE, I'd like to take a moment to thank Minnesotans for their persistence with us this school year. As an educator for over 25 years and a mom with 2 children in our K-12 system, my heart was with you every step of the way. Our students, especially our graduating seniors, our families, and every single teacher, paraprofessional, bus driver, food service worker, custodian, and administrator worked hard to make this the best spring that it could be. Thank you. We know it was not easy, and it was especially hard for our communities of color and our Indigenous communities. As we look ahead to the next school year, the health and safety of our students will continue to be our #1 priority. And that is why today the Minnesota Department of Education and the Minnesota Department of Health released guidance documents to help Minnesota schools plan for the 2020-2021 school year. We're asking our school leaders to create 3 different contingency plans based on 3 possible scenarios that the virus could put us in. In-person learning for all students, hybrid learning with social distancing, and distance learning. It is possible that next year, just like we saw this year, schools may need to shift their educational delivery models mid-year based on what is best for public health and the health and safety of our students, their families, and our school staff. That's why Minnesota allocated federal dollars for schools to purchase technology for our students so there can be a seamless shift to a hybrid learning or distance learning model at any point during the 2020-21 school year. Ultimately, we know that schools and families are anxious to know which scenario we will be in this fall, and we just don't know yet. We will be announcing our recommendation for which educational delivery model would be the most appropriate for this school year no later than the week of July 27th. Now, while we're certain about how the pandemic will evolve over the next couple of months, the proactive planning that our school districts and charter schools are doing this summer will ensure our school communities are prepared for whatever this school year brings. As schools are doing their contingency planning, we are urging that they keep students at the center. With all the different logistical considerations, I want to caution my fellow educators from simply approaching this as a complicated math problem of who can go where and when. At the end of the day, the most important thing is that our students feel like their school community, whether they're interacting with that community in person or in a hybrid or distance learning model, is a safe and welcoming place for them to learn and grow. This spring was incredibly difficult for our students, and it was especially difficult for our communities of color and Indigenous communities. The trauma experienced by our students with the dramatic changes in the pandemic brought to their lives, and with the murder of George Floyd, students are going to need the caring and thoughtful adults in their lives to show up for them now more than ever before. Schools should spend considerable amounts of time creating a plan to address how they are going to support the mental health and well-being of their students and how educators and school staff are going to boost their work around equity and cultural competence. Educators are familiar with a certain amount of learning loss that occurs over the summer months, but with all of the challenges faced by our students this spring, our teachers will be prepared to address even more learning loss this fall. This could include reviewing what was taught during the distance learning period this spring, identifying gaps, and creating a plan to address those gaps. Once again, we know that we are asking a lot of our educators and our school staff, but we wouldn't be asking if we didn't know and believe that they were up for this challenge. Over the next couple of weeks, in addition to working very closely with the Department of Health to monitor the public health situation and what it will mean for our schools this fall, the Minnesota Department of Education will continue to review the successes and challenges of the distance learning period and engage with students, families, and school staff on how we can make a fall a better experience for all. In partnership with the Wisconsin-Minnesota Comprehensive Center, the Minnesota Department of Education is engaged in a systems review of distance learning plans looking specifically at structure, content, and equity. In addition, with over 150 participants representing stakeholders from educational organizations, community organizations, teachers, advocates, students, and families, MDE engaged in a distance learning feedback groups to get additional information about how we can ensure that our hybrid model and our distance learning models support the needs of our unique students. We also created and administered a statewide survey for families to gather additional feedback. This survey is available on our website in English, Hmong, Spanish, and Somali, and we urge all families to take it. Your feedback is incredibly important. None of this is easy, and we don't know what going back to school will look like. But I do know that as schools take the time to create their contingency plans this summer, no matter what the virus brings in the months ahead, our students will come back to better this school year. Thanks, and I'd be happy to take any questions. I'm going to pass it back to Mike.
Thank you, Deputy Commissioner Mueller. Operator, I think we're ready to take questions.
As a reminder, to ask a question, you will need to press star 1 on your telephone, and to withdraw your question, you may press the pound key. We will pause for a moment to compile the Q&A roster. Right, we now have a couple of questions that came in. First question comes from the line of Elizabeth Shockman of Minnesota Public. Elizabeth, your line is now open.
Hi, thank you so much. You outlined a lot of details in this document on addressing very specific health concerns. Can you talk a little bit more about the advice you're giving to schools to address equity for Minnesota students?
Thank you. So some of the things we are working on is we have targeted equity as a cornerstone and the backbone of the way that we approach education. As the Department of Education, in partnership with our school districts as well as our charter school leaders, we have identified specific areas where we can be very purposeful, focusing on individual student groups as well as individual needs. We recognize that there are times when a all-in approach and looking at the students or the schools or the grade levels in inequality is vastly different than looking at equity. And there are appropriate times when it is every student, and then there are times when it is differentiated based on specific student groups and student needs as well as individual needs. And so that is embedded throughout the plan, and that is something that our school districts are consistently working for.
All right, moving on to the next question from Kent Erdl of Carey Television. Your line is now open.
Yeah, one of the big questions we've gotten involves the hybrid scenario. How much flexibility does the state anticipate having with some of the districts? I mean, is this going to be a unilateral decision on July 27th or around there? Or is there going to be flexibility in there if there is some kind of a hybrid scenario?
Thank you for that question. What I really appreciate is our partnership with the Department of Health, and we've had a lot of conversations about this. And it really is moving toward a more scaffold approach. And we had this conversation with our superintendents and charter school leaders earlier today. We are looking at the state as a whole, but recognizing that there are places that are not being impacted in the same ways in schools and school districts. And so we are looking at how is it that it is possible that there is a unique need in a school district, a community, a county, a region, and it is possible that there are recommendations based off of an outbreak or some type of surge in one area of our state or in a community or in a school, that school would be in a hybrid model or a distance learning model, and another school in a neighboring county who is not experiencing that would not be in a hybrid model. They could be in person or they could be in a hybrid while the other school is in a distance learning model. And that is something that is unique to what we've been able to move forward with, and I really appreciate the thoughtfulness and approach that the Department of Health has helped us to think about in that way, and really helping also to facilitate those decisions. Those are not decisions that charter school leaders or school districts are going to want to make in isolation. That if there are cases in their schools or in their communities, that we know that the county departments as well as the Minnesota Department of Health are really great partners in helping to identify and make decisions in that. Commissioner Malcolm or Chris, would you like to speak to that too?
Thanks. This is Commissioner Malcolm. Thanks, Heather. That was a great description. I think, as we have said over and over again, what can seem to be an isolated concern in one community can impact other communities. So it is important to kind of keep both in mind, kind of what's the overall state situation. But as Heather said, we are more and more tracking and trying to understand local variability and what's happening.
All right, next question comes from the line of Glenn Howitt. Glenn, your line is now open.
Thank you. As you're aware, in the last flu season, we had over 900 school outbreaks because the yearly circulating strain, strain B, affects kids. Even with social distancing and other precautions, does that experience give you concern that we could see outbreaks like we saw with flu if you return to a in-school model?
Well, Chris, could you take that one?
Sure. Yes, I mean, we definitely last year was a unique year with influenza B as the predominant strain, and we did see a lot of activity in our younger populations. And as we look ahead to this fall, our efforts are not only on how we continue to mitigate COVID activity in our state, but it will also be what activities and what actions we can take to make sure that we're doing everything possible to address influenza, because we recognize that the combination of COVID and influenza could really be problematic. So our planning is focusing on how do we mitigate not only the impact of COVID, but also influenza. And so certainly that will be taken into account as we're working with the Department of Education. But obviously the focus of their planning has been in response to COVID. But you're right that as we come into the fall, we need to be looking at multiple respiratory illnesses that could impact our educational system.
And why not make a decision now? Why delay this decision on what you're going to do?
This is Commissioner Malcolm. I guess I would just say, and certainly Heather, Chris, jump in, that as we've said over and over again, there are just evolving and growing knowledge all the time about the virus, how it works, how it affects kids, the role of kids in transmission. So in this sense, certainly understanding that everyone is eager for as much planning, lead time, and clarity as possible. We have wanted to get as much experience kind of under our belts and learn from communities elsewhere and around the world as we can, because we realize this is just such a critical issue that is so connected to so many other things about parents' ability to work, and just to reinforce again Heather's point about the fundamental impact that education has on kids' well-being over a lifetime, and a deep concern about the degree to which the distance learning model has not been equally successful for all kids. So we're trying to do as much planning about how to mitigate risks in something that isn't exclusively distance learning as we can.
This is Chris Erisman, and I'll just add to that, if we had made a decision a month ago, it might look very different than a decision that we make now based on changes in the data. And so we want to make sure that the decision that is made as close to the time that will have an impact as possible, while still allowing more time for planning. So we want to be able to see how is COVID affecting Minnesota for a number of additional weeks before the decision is made, but also recognizing, as you said, people need time to plan. But if you think back and think if we made this decision a few weeks ago, it might have looked very different. So we want to make sure that we're making a decision or making recommendations for consideration that are as close to timely as they can be.
Thank you.
Next question comes from the line of Catherine Richard of Minnesota Public Radio. Catherine, your line is now open.
Yeah, this question is for the Education Department. Just going back to this equity issue, can you give us some very specific ways in which you will prioritize the learning and equity of students of color, low-income students, students with disabilities? For instance, I'm wondering, would you prioritize, child care for children of color or technology access? Just give us some more specifics on that.
Sure, thanks for the question. One of the things, so when you talked about specifically about technology access, that's one of the things that what we have done is with the GEARS dollars and the ESSER funds have targeted really three specific things. With our GEARS dollars, the first thing is that we have targeted funds for technology to really help school districts think about and to gather the data and then support the acquiring of access to technology as well as to internet services. And so that is one piece of the technology, and it's specifically targeted to students who are underserved and underrepresented. The second is really looking at how it is we deal with support staffing. And in the hybrid model we talked about specifically this summer, it really is targeting students who have been disproportionately disrupted in their education and has had impacts that are different based off of historical context of racism and bias. And so that would be the second piece. And the third is really looking at 0 to 8 and thinking about students who need enrichment, our underserved populations, and partnering with our nonprofits to help to support enrichment activities. So that would be those three pieces. The second is really thinking about the ESSER funds. And the ESSER funds were identified to give to school districts that they could use at their discretion, but specifically we've asked them to prioritize three areas. One, if the GEARS dollars did not help you get through every single student who needs access to devices and or the internet, then use those dollars to help to solidify that. So that way, if we were to move into a hybrid model or a distance learning model in the fall, that we ensure that our students have the access to technology and they're eliminating the digital divide. The second was to, again, support staffing and ensure that we have the people in place to be able to provide the learning in an environment that is a hybrid model or a distance learning model. And the third, and one of the most important, is the inclusion of mental health supports and really elevating that, being thoughtful about expanding social workers, school psychologists, counselors, school nurses, and school therapy options to support students who have been disproportionately impacted in their mental health. And so those are specific ways that we are targeting funds to be able to help to support that. So when you look at the academic components, there are very specific things that we've targeted not only in our guidance, but it's made recommendations about how it is that we would be able to support our students as they are coming back in with learning loss and targeting students individually as well as in student groups. We know that there were inequities that were being highlighted during distance learning, and that's why we're asking schools to prioritize that in their planning so that there are not students that are left behind.
Just a quick follow-up here, and more for the health side of things. Chris, you said at the top of the call, young people, please don't congregate, wear masks, wash your hands, don't go to parties. And yet we're also hearing that having kids back in school is a possibility this fall, but we still don't know a whole lot about how kids spread the virus. And I'm just wondering, if kids are back in school in any way, is this going to be kind of an experiment in figuring out whether that would lead to a further explosion of coronavirus this fall? It just feels like we're hearing two things at once,
Well, certainly, let me just clarify that we know how kids spread the virus, and it's the same way that adults do. It's via the respiratory route. So I think what you're getting at is that the uncertainty is what role do kids play in additional transmission in communities. And I think that what we're trying to weigh, and as was described by the commissioner and deputy commissioner, is that we're really trying to thread a needle or really balance the critical role that education plays in society and in a child and young adult's life with public health goals and public health needs. So we're trying to balance that. And what I was talking about in terms of really asking our younger population to wear masks and to make sure they're social distancing, those are the wonderfully fun but very optional activities. And I certainly wouldn't want to suggest that they're not important, because they surely were important to me at that age. But those are activities that there's a little bit more discretion with. And so we're trying, as I said, we're trying to balance the importance of education with public health goals. But I think the ask of young people to prioritize being thoughtful about COVID, just like they are about our environment and racial justice, is a reasonable ask, particularly over these summer months. Thank you.
Next question comes from the line of Lou Vergoose of CARE. Lou, your line is now open.
Thank you. This question is for Chris Harrisman. Talking about those age-adjusted rates, you mentioned a couple things that stand out to you: the hospitalization rates for Asian and Hispanics, and the death rates for Black people being higher than white people, I assume. Can you answer two things? Can you say why do you think that is? And then also, is there anything else, once you put the data in this form, that stood out to you?
Those are really the most important differences. But I think the key is that when we looked at the data, when we compared the standard unadjusted data with the adjusted data, we did see significant differences, and that's why we thought it was important that the age adjustment really helped us refine our understanding of the data. And what the age adjustment does is it takes into account how the population differs by age, and so there's some weighting that is done. And in doing that, we saw that our Asian and Hispanic populations definitely had, higher rates of hospitalization, and that our Black population had higher rates of death. Now, that's not to say that we weren't already seeing disparities. We were seeing disparities in the data, as the commissioner has talked about, but this really allowed us to refine it, and by taking it to that next level of really looking at how did the populations, making them more comparable to each other, we saw a greater disparity. And we think that's important. These are issues that we need to address, and we want to make sure that we're fully understanding the problem that we're seeing.
And have you heard from, doctors who are actually seeing patients and at the hospitals and so forth about what some of those reasons are medically?
Oh, you mean that they are reaching out to us that they were? We have had providers reach out to us to say that they are seeing increases in these populations. They have not offered anything particular. I think that they were seeing similar risk factors, but just that by adjusting for age, we're recognizing that the disparity is greater than what we had seen before.
Okay.
Yeah, and I think it's just Malcolm. I think it's just important to just tease out a little bit here that there's nothing that we know that suggests that the biology is necessarily different, and certainly that's something always to be looked at, or the impact of the disease itself being different, but more that it's the conditions in the community that might put certain populations at greater risk of exposure, or the types of jobs they work in, et cetera. So it's sort of, but I think as Chris was saying, we had seen the disparity in in some parts of the data and not others, and we were curious about that. So this age-adjusted method allows us to see the full impact of the disparities, and as Chris mentioned, makes them even more stark in comparison. So, Chris, I'm sorry, did I cut you off there?
No. You actually said I realized that there was a perception that somehow the disparities were due to race or ethnicity. They are absolutely not, as you said. We're seeing them in different racial and ethnic groups. We have disparate rates, but it has nothing to do, as you said, with a different biology or a different disease process. It's absolutely other things. So just glad that you clarified that.
But like some things we've talked about before, such as certain pre-existing conditions being more common in some people than others, that sort of thing leading to it, as well as the different job types and whatnot?
Oh, certainly. It's certainly the prevalence of pre-existing conditions, it can have an impact, but that is not necessarily a racial construct. It oftentimes has to do with other, disparities in society. And so I think that's the point that the commissioner and I want to make sure that we're making, is that this is not biologic tied to race or ethnicity. This is tied to other factors that are sometimes associated because of how our society is structured.
Thank you.
Next question comes from the line of Josh Bertas of Pioneer Press. Josh, your line is now open.
Thank you. The guidance discusses alternatives for students and staff who are high risk. I'm wondering about students who are not high risk but just don't feel comfortable going back to school. Their parents don't feel comfortable sending them to school. Under scenario 1 or 2, will schools be required to offer distance learning for families who insist on it, even if they're not in high-risk categories?
Thank you for the question. That was one thing that we have made a recommendation on, and we are thinking about, because this is very similar to something that happened in Leroy at the beginning of March, is that there were students who, for a variety of reasons, their families did not feel comfortable with them coming into the school building. And what we know is that, we believe in our public education, we believe in our public health partners and the recommendations that we are making together in this. We believe we're in the best interests of our students and our families, as well as our staff and community. But in the end, families have the option to make the decision that they believe is in the best interest of their students, and we would never get in the way of that. And so really being thoughtful about how it is that we can provide that support for their students and for that family out of a school district, out of their school district, their home district, where they have those solid relationships. They have built those peer-to-peer friendships and are wanting to maintain that continuity. And so those are pieces that we have made recommendations about for our school districts, is to be able to offer or provide some type of support.
Mm-hmm.
Next question comes from the line of Eric Newland of the St. Cloud Times. Eric, your line is now open.
Hi there. This question is, I think, for Heather Mueller. We're looking at on the hybrid side of the plan. Is there funding available for any materials, be it cleaning materials or other materials that might be needed in order to reconfigure a school for a certain amount of occupancy? We're especially thinking of the extra cost that a 50% busing capacity might incur. So I'm just wondering if there's any funding available for those costs as they pop up.
Thank you for that question. That is something that we are looking at. We recognize that in the current model, of a hybrid model, it is, and the recommendations around transportation that come out of the CDC is a 50% busing, and we know that our school budgets are set with the parameters that the number of students that they have are going to be riding the bus, and that they can be at full capacity, and that is more than one person per seat in between and another person, or family members riding together. And so we are looking at funding options and how it is we would be able to support not only transportation, because one of the things is we cannot have hybrid learning unless we can get the kids in the building, and we need to be able to support our school districts in that. And then when we get there, we need to make sure that they are safe and that we have the screening and cleaning supplies that to be able to.
I'm sorry. There was something cut in there.
Do you need me to go back to something cut in there?
No, I don't believe so.
Okay.
Yeah, I guess I don't have a follow-up to that one. Thank you.
Thank you.
Next question comes from the line of Sarah Danick of Fox 9. Sarah, your line is now open.
Hi, I was wondering, the survey that was released on Monday for parents to fill out from the Department of Health asking for them to weigh in about how their experience went, how much of their answers is going to figure into planning for the fall, and will you take those into account when you're trying to make these decisions?
Yes. I mean, the feedback that we're asking for is incredibly important, and we are going to be able to take that as part of that triangulation of data that we're looking at. One is in the systems review that we've been doing with the Wisconsin-Minnesota Comprehensive Center. The second is in the feedback groups that we've done in that partnership as well. And then the third is really focused in on what our parents are telling us. And what our parents are telling us is incredibly important. And we're going to take that data, look at the themes that kind of rise to the top as a result of that, and we will share that with the public. Like we said, it's important for people to be able to see what it is that they've said and how that's being reflected in their documents. This guidance document is a start. It is something that we have built based off of the feedback that we've garnered from our very first two components, as well as feedback we've heard from parents throughout the distance learning period. But we will have the opportunity to make adjustments to that and either continue to support and add components to that document and make adjustments to that. And so the feedback is something that we know is not just actually a conversation for now. It's going to be a conversation that is ongoing. We know how invested our families and communities are in the education of their students, and we want to make sure that we are providing the support that is needed for not only our students and communities, but for our school districts and charters to do the work that they need to do.
Okay, thank you.
Operator, we have time for one more call. One more question.
All right, next question comes from the line of Darren Svensson of KTOE Radio. Darren, your line is now open.
Thank you. This question is for Heather. You mentioned there were some issues with distance learning, and I think anyone who expected everything to go smoothly with such a short time to adjust a new model probably wasn't being reasonable. Is there anything related to distance learning, knowing its possibility come the fall, at least in some way, shape, or form, that districts have learned or the state has learned to improve that process should you need to go back to it? Or is the delivery of education so district-specific that you guys can provide guidelines, but it's really up to the districts to look to improve on the ways they've been doing things?
Well, thank you for that question. I'm going to answer that it's a both response. The partnership that we have with our school districts and charter schools really means that that they do have local control, and that their delivery model on how they want to deliver that it is an individual decision. But what they deliver is something that is driven by the Department of Education and by the legislature as well in those standards. And the guidance that we create is really targeted to help to think about and ensure how is it that we are going to move forward together, and what can we continue to provide. So one example of that, again, is in the area of technology. That is one piece. The second is around family engagement and student engagement, and how can we ensure that we have more touch points, if possible, throughout the day, and what are the systems and structures that we can make recommendations about in order to do that. Another is around that we can provide support on to our local communities and school districts is the professional development. Again, we have had educators who are incredibly qualified who have gone to school to do this work and are now in a position where it doesn't look exactly what we thought it was going to look like. And so they're also trying to learn an entirely new system and think through that at that point in time, and then to be able to deliver that in the high quality that they are used to delivering in their classrooms. And so our role and responsibility is that there are times as a Department of Education where it is our time to lead with school districts. There are times when it is our obligation to partner, and then it is our obligation to support. And we walk through all three of these, and we are thinking about distance learning and hybrid learning specifically.
Thank you, Heather.
Thank you.
That is all the time we have for this afternoon. I want to thank our speakers and the reporters on the call. If you had a question we were not able to address, please feel free to reach out to the communication staff at either the Health Department or the Department of Education. Have a good day, and we will talk again soon.
This has been a WDIO News Special Report.